Most people think sciatica shows up out of nowhere. One day you're fine, and the next day, maybe your back, your glute, your leg is screaming at you. In reality, you may find there's warning signs in the days or weeks leading up to that event. Today, I'm going to show you 3 signs that may show up before your sciatica discomfort starts and what you can do about it to be proactive in the days before a flare-up. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor, and here we are at One Life Family Chiropractic. And today, we're going to be talking about 3 signs your sciatica is starting before the pain shows up. Of course, if you're just tuning in, I love being a part of your health journey. Take a moment, make sure you like and subscribe so we can see some more of each other in the future as well. Remember, in the big picture, sciatica is usually a process. Sciatica is often an irritation challenge, not necessarily some sudden injury. The body can sometimes give you clues, and I want to teach you some of those simple things you can take note of today. And the challenge is most people ignore these potential clues, and guess what? Until the pain forces them to slow down and make a change. Often the earlier you respond and get proactive about things, the easier it is to calm things down and bounce back quicker. Sign number 1, your hips start feeling stiffer. One of the first things I often hear is, oh, my hips are just getting stiff. My hips just feel tight. I feel stiff getting in and out of the car. And some of those common things that I hear, and the hips don't move like they normally do. And why this matters? When your hips lose mobility, remember, the low back may move more, the pelvis may become less efficient, the sciatic nerve may become more sensitive if the movement pattern starts to break down. So common areas, well, hip internal rotation, hip extension, and stiffness in the glutes and not being able to move the way you were designed. And remember, tight hips often precede irritated backs. Sign number 2, one glute stops working as well as it could. And this is a big one. Before the pain may appear, many people notice one glute may feel weaker, one side may feel harder to activate, and walking may even feel slightly uneven. And why this happens? The nervous system may begin changing movement strategies. The body's shifting load away from one side, and the low back potentially starts helping more than it necessarily should. I want you to perform this simple test, and I want you to take note. Am I feeling both glutes equally when I push through and drive force into my glutes? Or does my back and hamstrings begin to take over? If the glute disappears, the back often starts working overtime. Sign number 3, that morning stiffness starts increasing. And a lot of people may dismiss this sign, and they may just be saying, I just need a few minutes to loosen up, and or I'm just getting older. But what may actually be happening is that disc pressure is increasing overnight. Joints become less mobile and more stuck. And the nervous system is becoming more protective, trying to adapt and look after you, but your movement pattern is starting to break down. So pay attention if you're noticeably stiffer than normal, it takes that much longer to loosen up, and the first few steps of the day feel uncomfortable. This can often be the body's early warning system. Now, why these signs matter? The progression may often look like this. Hip mobility decreases, glute function starts to decline, morning stiffness starts to increase, the load sharing starts to change, and sciatica symptoms may begin to appear. Keeping in mind that the pain is often the last thing to show up. Meanwhile, you're starting to dysfunction long before that. So here's what to do when you start to notice those signs. And step 1 is make a point of walking more frequently. Break up your sitting habit starting now. And step 2, work to restore your hip mobility. Start right here. If you're at your desk and you have your chair, make a point of doing the couch stretch just like this. Remember, 60 to 90 seconds at least. My preference in this one, 2 to 3 minutes per side. And I would really make a point of doing it multiple times a day. Standing up tall, squeezing your glutes just a bit, hanging out, breathing out to a count of 4, longer than you breathe in to a count of about 2. And there you have a breathing exercise combined with opening up your hips and improving the extension. Oh, hey, work on your hip 90-90s. And what you can do, you can come back and forth just like this, pausing, breathing, 20 to 30 seconds here, switch sides. Again, you're working on the hip rotation, focusing on your breath again, 4 seconds out and 2 seconds in. And this added one, focusing specifically on this position, being upright. And what I would lean forward and do is just hang out there until I feel my glute tension focusing on opening this glute up, getting that hip internal rotation of the other side, and just breathing 60 to 90 seconds on each side. And you gotta get to waking up your glutes. Simple exercises like this, the single leg hip extension, I would do at least 8 to 10 reps on each side, focusing on breathing out on the way up, contracting for 1 second, and then back down. And of course, the side plank and open up to that clamshell, just like this. Come up, extend your hips, and clamshell it open and back down. Focusing on breathing out as you come up, and 6 to 8 reps per side to help condition your core, your low back, your glutes, and get your muscles firing, the ones that may be undertrained, help bring up your conditioning and make your day that much easier. And step 4, modify the load temporarily. Some relative rest, decreasing the percentage points, but still focusing on moving are going to be one key step. Also, don't wait until symptoms become so severe that you can't move and do what you love. Take a moment, reset, draw things back a little bit, focus on this simple routine, focus on the right type of movement. Small corrections now can often be proactive about bigger flare-ups later on. Remember, as you move through and do all these wonderful things, often the X factor is what I call the chiropractor, addressing the health of the spine and nervous system. Remember, your brain sends messages to your muscles, organs, and helps with how you heal. Your corrective chiropractor looks for proper spinal motion and also any areas of nerve irritation. So some areas you may notice, but there's going to be many areas you may have no idea about. And that's why it's so important to get tested to address the health of the whole system. And it all starts with a case review to help understand more about what's going on with your health and your goals, and then potentially into a biostructural examination to understand and test more and not just guess as to what's going on. So your corrective chiropractor can help your body thrive, work better, and get back on track potentially that much quicker. If you like less down days and being more proactive about your health and improving your performance, consider the health of your spine and nervous system. Anyways, I loved having you today. Remember, small steps really do make a difference. And of course, I love being a part of your health journey. Just take a moment, make sure you like and subscribe so we can see more of each other down the road. And remember, go out there, do something small for yourself. And remember, you're far stronger, more resilient, and resourceful than you may be able to believe. Bye for now.